Social distancing comes with psychological fallout. As increasingly stringent measures to keep people apart are put in place to slow the spread of the coronavirus, mental health experts are warning that losing everyday social connections comes with psychological costs. And those costs could go up the longer such measures drag on. In response to the accelerating pandemic, a growing number of states have banned all non-essential activities and asked residents to stay home. Across the country, colleges and offices have gone entirely online, schools and restaurants are closed and nursing homes are barring visitors. Such social distancing can stop, or at least slow, the spread of COVID-19, the disease caused by the new coronavirus. But for some people, a lack of social connectedness feels as impactful as not eating, says Joshua Morgenstein, a psychiatrist and disaster mental health expert at the Uniformed Services University in Bethesda. Research on the psychological toll of social distancing during epidemics is limited. But a review in the March 14 Lancet provides some clues. Researchers evaluated 24 studies looking at the psychological outcomes of people who were quarantined, an extreme form of social distancing, during outbreaks of SARS, H1N1 flu, Ebola and other infectious diseases since the early 2000s. Many quarantined individuals experienced both short and long-term mental health problems, including stress, insomnia, emotional exhaustion and substance abuse. For instance, one study compared quarantined versus non-quarantined individuals during an equine influenza outbreak. Of 2,760 quarantined people, 34%, or 938 individuals, reported high levels of psychological distress, which can indicate mental health problems such as anxiety and depression, during the outbreak compared with 12% of non-quarantined individuals. Another study looked at the effects of the 2003 SARS outbreak on 549 hospital workers in Beijing. Those who were quarantined or worked in high-risk settings, almost half the sample, reported higher levels of alcohol abuse 3 years later than workers with less intense exposure to the outbreak. Certain factors increased the risk of psychological problems, such as quarantines lasting longer than 10 days, which was associated mostly with post-traumatic stress, poor information about the rationale for the quarantine, and lack of access to necessary supplies and telecommunication services. Mitigating those risks can reduce the likelihood of mental health problems, says review co-author Neil Greenberg, a psychiatrist at King's College London. Although isolation can be unpleasant, he says, it need not cause serious mental health difficulties. Though most people living in coronavirus-stricken countries aren't quarantined, research elsewhere suggests even less extreme forms of social distancing, such as staying several feet away from other people or avoiding regular outings, might take a toll. The potential for social distancing to become a long-term event is what worries psychiatrist Damir Huremovic of Northwell Health in Manhasset, NY. Health problems associated with social isolation tend to crop up when the situation goes on beyond a few weeks, he says. Walling people off from one another for months means the secondary effects of the pandemic, such as recession, social unrest and unemployment, could trigger unpredictable and widespread mental health challenges. I sincerely hope we do not get to this stage, says Huremovic. More information, www.sciencenews.org.